prior to the advent of technology, the way we were placing our implant is what we called freehand, which meant that we would bring a patient in for a surgical procedure. We would open up their gum tissue, and then we would visualize the bone, and then based on what we saw there, we would drill and place the implant based on what we felt was best. With the advancement of technology, we are able to now go ahead and take a cone beam CAT scan, which is a three-dimensional image of the patient's jaw, digital impressions of the patient's mouth, and we're able to plan your surgery prior to you even coming into the office. We do this by merging and putting together the data, and we do your surgery virtually on a computer screen. We're able to know exactly how tall the implant needs to be. We know exactly where certain anatomical structures are within your jaw, what angle the implant needs to be placed, and then we are able to translate that information from the computer screen to a printer, which 3D prints what we call a surgical guide. That surgical guide on the day of surgery will go into the patient's mouth. This allows us to perform very accurate and precise surgeries as a result of the fact that the drill can't go to the right, can't go to the left. It's being held in place by that guide that we 3D printed based on the plan that we made virtually on a computer screen. The advantage to this over the old way, which was the freehand way, is that number one, it cuts down on surgical time. Patients are in the chair a lot less. Post-operative pain, there's a lot less post-operative pain as a result of less surgical time. Additionally, there's minimal cutting, as opposed to the old way where we had to cut and open up everything to see what the bone looked like, to see how we wanted to place our implant. Now we don't have to do that as much, and as a result, patients are happier because they don't have as much post-operative pain. The downside to placing an implant freehand is the human error aspect of it, where we can be placing our implant and we are off a little bit to the right or off a little bit to the left, and as a result of that, our implant is not in the correct position, which will result in the tooth not being in the correct position. So we want to make sure that we do things as precise and accurate as we possibly can, and that's where guided surgery plays a role. If you have any questions at all, whether it's in regards to dental implants or your general dental needs, feel free to reach out to us at Long Island Implant and Cosmetic Dentistry. We're here for you.